Hey everybody, welcome to Lillian Live in New York. Excited to have you here. We have all kinds of great content. Just remember to like us on Facebook and post, repost. And tonight, we have an amazing couple. They have a CBD business and they're very interesting. And the title of tonight's episode is Using CBD and Chinese Medicine to complement mainstream therapies. Now, of course, before starting any wellness regimen, you always want to check with a medical practitioner. So without further ado, we're going to introduce you to Colin and Stephanie Coogan. Hi, guys. How are you?
Hi, Lillian.
Hey, how's it going?
Hi, how are you?
Very good. Thanks for having us.
Yeah, thanks for having us.
Thank you for coming on the show. We're really excited. It's a very cool topic. And not everybody can say they have a CBD business. So I want to start with you, Steph. You are a Chinese medicine herbalist. Can you tell me what that is?
So a Chinese herbalist can prescribe Chinese herbs, whether that be raw herbs for making your own tea to pill form. Many different types of Chinese, formulas that patients can take that I can prescribe to help with many different ailments that they might be, getting treatment for.
Wow. And how did you get into this line of work? It's so interesting.
So basically, I became a Chinese medicine practitioner, which acupuncture and herbal therapies, because just through my own experience of acupuncture years ago when I was living in Northern California, I went to an acupuncturist for my own symptoms at the time, and it just really got me interested in learning more about the medicine. So eventually, when I moved back to the East Coast, I just got into school, and I was just so amazed and blown away by the effects of the medicine that I had through my own personal experience. So I just wanted to really learn the medicine, and it kind of started my path for to become licensed. So
that's really amazing. So that guests, if you haven't heard, viewers, that Stephanie is not only a Chinese herbalist, but she is an acupuncturist. So. And she has 4 kids, which I don't even know how they do it. But so now, what? I know you work with CBD as well. What exactly is CBD?
Well, CBD is basically a component of basically. It comes from the plant, the marijuana plant, but it's pretty much like the second prevalent force. So it doesn't have the THC properties. It just has like the healing benefits, basically. So when I incorporate into my medicine, with what I do, it can treat different symptoms when patients come to see me for a variety of things.
You said it doesn't have the TCH properties. What is that exactly?
Right. It doesn't have the THC properties.
THC. Okay.
So it doesn't have like any psychoactive,
It's the non-psychoactive cannabinoid in the hemp, cannabis sativa plant. It's mostly been used for anti-inflammatory pain, and I guess the most popular study was working with epilepsy. It's kind of got it on the map in the beginning with Charlotte's Web, that pulling in. But what we found is it really helps with inflammation, and what we found to use that together with some of her Chinese herbs and the CBD will really help, Stephanie's patients with neuropathy pain, and with really as pain and anti-inflammatory. And inflammation is probably the number one ailment that people overall have a problem with, and CBD has probably been the best at helping with that.
Wow. So are there are there other methods of CBD usage that work for pain? Like, what method is it exactly? It's an herb, or what exactly is it?
Well, it's a compound that's extracted from the plant, and we've like the one. I mean, it's been around for a while. Taking it, ingesting it orally, either in a capsule or tincture, but it's also has a lot of good topical uses, and that's what some of the products Steph and I have worked with is using like a salve with some of her Chinese medicine and incorporating CBD to kind of get that synergistic effect of them working together.
Wow. So Steph, how are you using the herbs and the CBD with your patients? How's it, what are you doing? How's it going?
Yeah, well, pretty much like Colin just said, I use a lot of topical CBD. Like we have a CBD ointment that we use, which my patients like a lot. So it has CBD. Some of the other products that I have do incorporate Chinese herbs and CBD, but they work really well for any pain-related issues, whether that's acute, chronic pain. For instance, like low back pain, somebody's been struggling with hip pain for a long time, they can just put it directly on where the pain is coming from. Mm-hmm. Also, it really works well for, I've had great use for anxiety, calming effects. That is really big with a lot of my patients as well. They do notice that it actually really helps them sleep, even though it really isn't, I don't know, it's not talked about so much for helping with insomnia, but my patients do swear by it sometimes that it can really help with their sleep. I think it's more just the calming effect, kind of takes the edge off. So it can help in that way too. So topically, like Colin said, soft gels, a lot of people like the gummies as well.
I was going to ask about the gummies. Yeah. Okay.
Global, they actually really sometimes prefer that as well. So it just really depends on the person, on the patient that I see. But the topicals are great.
And another is they have patches, a transdermal patch where you can put that on the affected area, and it'll more localized work with this, putting the CBD right where you need it to go.
Wow. And does it? So if a patient is in pain and they're taking the CBD, how soon after are they feeling relief?
If they're taking it for pain, I mean, really, they can feel the effects. It really depends. Like if they're coming in for an acute, like injury or something like that just recently happened, it might take a little bit to kick in. It just really depends on whether it's acute or chronic kind of condition, but they can feel the results pretty fast. I mean, I've gotten really great results overall from the topicals.
The topicals are pretty instant, and you feel immediate, relief. I think when you ingest it, it probably takes around a half an hour, kind of like any kind of pill, for your body to digest it and start getting it into your stream. So
like for me, recently I've been having some issues falling asleep. I'm just, wide awake. I'm thinking, what would I do? What would you recommend for me, let's say, with the sleeping?
Well, there's a couple things. One is we work with CBD and melatonin. So like those mixed together, kind of that synergistic effect works. And another new cannabinoid, the CBD, THC and CBD are probably the two most popular cannabinoids in the plant. CBN, N as in Nancy, is one that's been, not really talked about and is just coming out into the mainstream. And that is a sleep aid, it's a sedative. And it's pretty much degraded THC, but it doesn't have a psychoactive effect. But it will really help with sleep. I'm working with another medical grower in Connecticut, and we're coming up with some specific sleep aids for CBN. So I'd probably say in the next 6 months, you'll start seeing a lot more products on the market with CBN geared towards sleep, because that's probably one of the biggest, industries out there for pharmaceutical is a sedative sleep aid. And one thing's really nice about CBN, it's not habit forming, and you don't really build a tolerance to it. So it's I think it has a lot of potential in the near future. Yeah.
Right, exactly.
So with the chaga, are there any studies, or what are the health benefits of the chaga itself?
Yeah, there's been a lot of studies. It stimulates the white blood cells. It's anti-inflammatory. In studies, it's shown anti-cancer fighting properties, slow aging properties. It does also help lower your cholesterol and blood sugar. So it's one of these superfoods. There's an ORAC, which is the oxygen radical absorption capacity. It's how they give a number to certain foods, like they're pretty much how they are against free radicals. And the ORAC value on chaga is like 140,000 versus like the Akia berry is 4,000. So it's again, the kicker is this is just through the roof of on that level of antioxidant.
Wow. So is it going to be sold in, I mean, where would we find, obviously we're going to make sure that the viewers know where to contact you. But what happens if somebody wants this and it's not, allowed in their state? Where would they get CBD, for example?
Well, CBD is legal in all 50 states. It was in the Farm Bill 2 years ago, where hemp was made legal and CBD. So there's no restrictions. I've sent hemp and CBD to almost every state. So I don't think and especially now, since it's been in the Farm Bill, people have haven't really gone after it, and there's really no way to really enforce it now that it's in the law.
Oh, okay. So so you mentioned hemp before. I know you mentioned to me that you're working on the microgreens. What's all that about?
Yeah, so I've been growing microgreens for years, and I've always thought about how great it would be to grow hemp or cannabis microgreens, but the seeds are so expensive, sometimes $10 a seed. So to grow a tray of microgreens would be very expensive. I just in the last 5-6 months, people have grown enough seed, and they cultivated the hemp plant that really focuses on growing little small baby plants. And just like with any microgreen, the micronutrient level is the highest in these small little plants. And that's one of the reasons I started growing, was nutrient density. Well, lo and behold, the seed price has come down, where it makes it economically feasible to do it. And I actually have some. I don't know if you can see them right here.
Yeah, wow, yeah.
Well, I can bring them closer. They're tiny little, baby plants.
Right.
And again, we eat them. I've been using them in cooking, putting them on the salad. And then we have also taken a handful of them and juiced them just like you would a wheatgrass. And I'm waiting to send those off to the lab to kind of get what's in there, and the micronutrient and the nutrient density overall of what's that compared to let's say a wheatgrass juice.
Yeah.
I think that's such a powerful plant, and they actually have a great flavor to them as well. So
I was going to ask you, what does it taste? Yeah, what does it taste like?
It's like cross between like lettuce and cilantro. Has a little bit of a zing to it. And
wow.
I really think that we're going to start selling them locally at the New Canaan Farmers Market. With the chaga people. They have a booth there, and we're going to start just focusing on the hemp microgreens and some other CBD products.
Yeah, I want to remind the viewers that we're talking with Colin and Stephanie Coogan of American Botanical Company. And if you are interested in any of the products, from the microgreen, hemp greens to CBD, definitely you can get in touch with Colin or Stephanie at the American Botanical Company at gmail.com. So you mentioned, so the CBD and the hemp, it's safe for the kids, right? Is the CBD also safe for the kids too?
Yes, yeah. Our kids have been on.
Yeah.
We have 4 kids, ages 6 to 13, and they've been on CBD probably for the last 2.5, 3 years.
Well, this is why you have such well-behaved kids.
Yeah, right. You haven't heard them once.
That's it. Yeah.
We got to get everybody on that.
Yeah, right. Exactly.
Wow. So that's so exciting. So, and Steph, I wanted to ask you something. I know you're an acupuncturist and a Chinese herbalist. You had mentioned to me that you work with some patients that have cancer and, maybe acne and things like that. How is the CBD and what you're doing a complement to the acupuncture?
To the acupuncture, I treat quite a few cancer patients. I have for the last 10 years. So the CBD along with the acupuncture just helps many symptoms, basically, or side effects from chemotherapy, radiation, maybe other drug-related side effects that they might be on. For instance, neuropathy is big, sometimes from chemotherapy or other chemo-related medicine that they're on can cause neuropathy, for instance, in your hands and your feet. And like we said earlier, especially with like the CBD ointment, putting that on your feet or where you're feeling the neuropathy can really help those symptoms. And also any pain-related issues like joint pain is really common with cancer patients that they see sometimes. That's a big one too. So they prefer, the soft gels if they're going to take it orally, or sometimes the gummies as well. But the ointments are really big when it comes to the pain and neuropathy. Those are the big ones.
And
of course, anxiety.
And you're working with some hospitals, right? And you're helping with the patients at some of the hospitals, right? Is that correct?
I have an SK here and good medicine. That's paranormal. So that's related work. So but I really and definitely really from the CBD on, along with plants, of course. I mean, per talking to doctors, of course, but we've just seen great effects.
All right. Well, I wanted to make sure that everybody knows, all the viewers, if you want to get in touch with Colin and Stephanie, you can reach them at American Botanical Company at gmail.com. I also want to, I really want to thank you both. It was such a great episode, really cool, really different. I know a lot of viewers are going to want to connect with you. And next week I'll be back with some more topics, and please share this with everyone, Well World TV, and thank you both. And, we have a lot to learn from you, and I'm really excited, and I'd like to try some to help me with my sleeping, because I'm having trouble just, falling asleep, staying asleep. So I'm looking forward to trying, and also trying the hemp greens and everything. Is there anything you wanted to say before we leave?
No, one thing I wanted to mention earlier was how CBD has been known to suppress your appetite. A lot of people have used that, to help with food. But one thing that CBN helps with the sleep, but it also will stimulate your appetite. So that's been, there's been some tests going on to help people, especially going through, different therapies, chemotherapy and stuff like that, to help give them that appetite, and maybe they don't want, the THC will do that as well, but the CBN will be a non-psychoactive way to do that and help stimulate your.
So you mean it would help me fall asleep, but then when I wake up, I'm really going to want to eat everything.
No.
Yeah, there you go.
Well, I think if you fall asleep before you eat, you'll be good. It'll be out of your system by the time you wake up.
Well, I have to tell you,
CBD in the morning.
Right.
I have to tell you that I actually did go through chemo a few years ago, and I did lose my appetite, and it was great because I lost some weight. But that would have been
need to eat food with that medicine.
Yeah,
sometimes you need to have that nourishment.
Right. That would have been good to know back then. Well, everybody make sure that you get in touch with Colin and Stephanie at American Botanical Company at Gmail. They're pioneers. They're trailblazers. They have 4 amazing kids. And there must be something with these greens and chaga and CBD and CBN that's working right. So thank you, guys.
Right.
And,
thank you so much, Lillian.
Thanks so much, Lillian. Thanks so much for your time.
Thank you.
Bye.
Thank you. Bye-bye.